Unfortunately, these days, all operations under our little brothers and sisters, nuestros pequeños hermanos, are facing a very severe financial crisis. And it's very troubling because our supporters around the world could not commit to help us at the level of our budget needs for 2013. We knew about that during the last quarter of 2012, and we've been planning and discussing on solutions, best solutions. Of course, we need to increase the controls to diminish as much as possible all waste and do our operation in such a way that we only use the money needed to run the hospital, to run the schools, to run the orphanages. I will talk more about the hospital since I'm the director of it. So we met and we have a good plan to use only drugs that we need. That means WHO essential list of drugs, no fancy drugs. Also do strictly the lab investigation that we need for each child coming here. That's on one side. But if things are worsening, we are considering cutting our operation. That means cutting 30 to 50% of our operation. Cutting the number of beds to hospitalize a patient. Cutting the number of children we accept every day at the outpatient clinic. And this can be bad for our population. You may know that access to healthcare is very difficult in explaining a very high mortality rate in children. And if anything, you don't want to diminish the number of hospitals you have in the country. So we're hoping that all the solutions that we're currently applying are going to bear fruits. We also have increased a little bit the symbolic fees that we're applying. Those fees only count for 3% of our operational budget. Nevertheless, we accepted to increase them to 6%. That means instead of paying $1 for chest X-ray, you're paying $2. They're still symbolic, but they're going to help a little bit. And so we're asking our supporters to help us face that financial crisis. Help us strengthen your support to us. Already, we're very grateful to the support that you're giving us, permitting us to offer healthcare to our fellow citizens. But please, if you can do a bigger effort to help us maintain what we have already started, that will be wonderful.